Hi, I'm Brad Kropp again from OKC Kids Urology, and I wanted to talk today. We're going to do a brief discussion about life after bladder exstrophy closure. So again, I think we talked about the different types of closure on the previous video, and now we're going to talk about life after the bladder closure. So we've had a successful bladder closure. We're all so happy that everything's went well. We're, several months after the closure, and what are we going to do now? Well, first of all, the main thing is, again, we're always going to focus on certain things. And number one, we're always going to focus on the kidneys, because again, the kidneys are going to be the most important thing that we want to protect. Okay, so we're always going to try to protect the kidneys. And the bladder, if it doesn't develop properly, can hurt the kidneys. So we're going to routinely check with renal ultrasounds. So we call that the RUSs, the renal ultrasounds. So we're going to do several of those. We start off at 1 month and 2 months, and then we kind of split it up to 3 months and 6 months, depending on that. And again, this is going to go on forever. We always are going to watch the kidneys. Patients with bladder exstrophy should have a renal ultrasound every year of their lives in order to protect those kidneys and watch any changes. After we make sure that the kidneys are okay, then we want to make sure if the bladder is growing. So again, we're going to check on the bladder growth, because remember, the bladder was extremely small usually at the start of the bladder closure, and we're talking about anywhere from 1 or 2 cc's or mLs up to maybe 5 or 10 cc's. That's the biggest bladders I've ever seen on newborns. And again, we want this bladder, it needs to grow. How big does it need to grow? Well, roughly, if we take the age of the patient and we add 2 ounces, then we're going to get the bladder capacity. So if you have a 1-year-old baby, then the bladder should be 2 ounces. And again, 2 ounces is going to equal 60 cc's or mLs. So that's going to be important. 2 ounces equals 60 mLs. So obviously 1 ounce equals 30 mLs. So again, urologists have a tendency to talk in ounces and switch it to mLs. So that's just a simple conversion. So we're going to watch the bladder growth, and we do that either by measuring the bladders, and some people will do that under anesthesia, and some people will do it, awake urodynamics. It involves basically placing a catheter into the bladder. So essentially then, at around 1 year of age, we start to think that there may be some other surgeries that are going to be required. If you've had the modern stage repair like they do at Johns Hopkins University, you're going to end up getting an epispadias repair in penis surgery. If you had a complete repair, you may or may not need a urethral surgery or a penis surgery kind of thing. In addition, then we talk about repairing the vesicoureteral reflux. So the reflux surgery may or may not be required at around this age. Again, it's going to depend on what's happening with the kidneys, the amount of reflux that is occurring associated with the bladder closure. So, and in addition, sometimes we'll do a modified bladder neck repair. Bladder neck is BN. So that may be required. But essentially, you can think about maybe I'm going to need a surgery at 1 year of age. But again, your urologist is going to base it on the renal ultrasounds, whether there's been any problems with urinary tract infections, and whether the penis needs to be completed. So then we have a fairly long period of time where we're just watching people. We're watching the babies grow. We're going to see if the child can become continent of urine without any difficulties or any further surgery. So roughly then, between the ages of 2 and 5, we're observing for any type of continence. Does the child feel his bladder or her bladder? Does the child able to stay dry and have dry periods? Are we going to be able to potty train the child? Because again, at this age, and is the bladder growing? Because remember, we're going to be measuring the bladder growth, and that's going to be every year. So basically every year we're going to try to remeasure the size of the bladder. And again, that's either done awake or under anesthesia. So then again, age 2 to 5, we're looking at looking at bladder growth. And then we've got to start thinking about continence. Think about continence. You know, is the child ready for continence? Are we going to be able to get this child out of a pull-up or a diaper at this point? And if the case is that the bladder is big enough and there's a weak sphincter, then surgery-wise you're going to be looking at what we kind of call the bladder neck repair. Bladder neck repair. And in addition, at that time, if the reflux has not been stopped, then we would also repair the reflux. And again, some of these are mixed and matched between the modern stage repair and the complete repair. But again, this is just generally what you're going to be looking at for the next 5 years. And again, then if the child is not deemed ready for continence procedures, then it can go anywhere from age 5, to basically 18, where you're going to be looking for signs that the child can be continent, the signs that the child is mature enough to have continence, signs that the child wants to get out of a pull-up or a diaper. Because again, remember, essentially only about 25% of people are going to be able to spontaneously void after either the complete primary repair or the modern stage repair with a bladder neck repair. So you're going to be then looking at some type of larger procedure in order to gain continence. I'd like to have that on another video and we'll do that so you can jump right in.